Trelegy Ellipta is a significant player in the world of respiratory medications, designed specifically for managing chronic obstructive pulmonary disease or COPD and asthma. It combines three potent drugs into a single inhaler, making it a convenient option for patients who need ongoing relief for their symptoms. This medication helps open the airways, reduce inflammation, and relax the muscles around the airways, which can greatly improve breathing and quality of life for those affected by these conditions. But what exactly makes Trelegy Ellipta so essential? Let's dive into its components and see how they work together to help people breathe easier. In this video, we'll uncover the top 10 facts about Trelegy Ellipta that every patient or caregiver should know. From how it works to potential side effects and alternatives, we'll uncover the key aspects that can help you make informed decisions about managing respiratory conditions. Number 1. What is Trelegy Ellipta? What are the active ingredients in Trelegy Ellipta? Trelegy Ellipta is a combination inhaler that contains three active ingredients: fluticasone, umeclidinium, and vilanterol. Each of these drugs play a unique role in managing respiratory conditions. Fluticasone is an inhaled corticosteroid that helps reduce inflammation in the airways, making it easier to breathe. Umeclidinium is an anticholinergic that works by relaxing the muscles around the airways, while vilanterol, a long-acting beta-2 agonist, helps keep the airways open. Together, these ingredients work synergistically to provide a comprehensive relief from COPD and asthma symptoms. The combination of these three drugs in one inhaler makes Trelegy Ellipta a powerful option for patients who need long-term management for their respiratory conditions. By addressing inflammation, muscle contraction, and airway obstruction, Trelegy Ellipta offers a holistic approach to improving lung function and overall respiratory health. Number 2. How does Trelegy Ellipta work? How do the active ingredients in Trelegy Ellipta help manage COPD and asthma? Trelegy Ellipta's effectiveness lies in its combination of three different medications, each targeting a specific aspect of respiratory conditions. Fluticasone, as an inhaled corticosteroid, works by decreasing inflammation in the airways. This reduction in inflammation helps to prevent the swelling and mucus production that can obstruct breathing passages. Umeclidinium, the anticholinergic component, helps relax the muscles surrounding the airways, which can become tight and narrow during a respiratory flare-up. Vilanterol, the long-acting beta-2 agonist, further assists by keeping the airways open and making it easier to breathe over an extended period. Together, these ingredients offer a multifaceted approach to managing symptoms. While fluticasone reduces inflammation, umeclidinium and vilanterol work on muscle relaxation and airway dilation. This comprehensive action helps maintain better control over COPD and asthma, improving the patient's ability to breathe comfortably throughout the day and night. Number 3. What was Trelegy Ellipta approved and what it is used for? When did Trelegy Ellipta get FDA approval? Trelegy Ellipta was approved by the U.S. Food and Drug Administration, or FDA, in September 2017. This approval marked a significant advancement in the treatment of chronic respiratory conditions, as it provided a new option for patients needing a combination inhaler that addresses multiple aspects of their symptoms. The approval was based on extensive clinical trials demonstrating the drug's safety and efficacy in managing both COPD and asthma. What conditions is it approved to treat? Trelegy Ellipta is primarily approved for the long-term management of chronic obstructive pulmonary disease, or COPD, and asthma. For COPD, it helps reduce the frequency and severity of flare-ups and improve overall lung function. In asthma management, it is used to control persistent symptoms and prevent nighttime awakenings due to breathing difficulties. It is not intended for the immediate relief of acute breathing problems, which is why patients may need a separate rescue inhaler for such instances. Number 4. What is the recommended dosage and how do I use it? What is the recommended dosage for COPD and asthma? For COPD, the recommended dosage of Trelegy Ellipta is one inhalation of the 100 over 62.5 per 25 mcg formulation once daily. This dosage helps maintain control over COPD symptoms and reduces the frequency of exacerbations. For asthma, Trelegy Ellipta can be prescribed in either the 100 over 62.5 per 25 mcg or the 200 over 62.5 per 25 mcg strength, with the same once daily dosing regimen. Your doctor will determine the appropriate strength based on the severity of your asthma and your response to previous treatments. How should Trelegy Ellipta be used properly? Using Trelegy Ellipta correctly is crucial for its effectiveness. To use the inhaler, you need to open the cover, inhale deeply through the mouthpiece, and then close the cover. Rinse your mouth with water and spit it out to prevent oral thrush, a common side effect of inhaled steroids. It's essential to use the inhaler at the same time each day and not to exceed the recommended dose. Setting a daily reminder can help ensure you don't miss a dose and maintain consistent symptom control. Number 5. What are the potential side effects? What are some common mild side effects of Trelegy Ellipta? Like any medication, Trelegy Ellipta can cause side effects, though not everyone will experience them. Common mild side effects include a sore throat, headache, and upper respiratory infections like the common cold. You might also experience back pain or a change in taste. These side effects are generally not severe and often subside as your body adjusts to the medication. If any of these side effects persist or worsen, it's important to discuss them with your doctor. What serious side effects should I watch out for? While rare, serious side effects from Trelegy Ellipta can occur. These may include oral thrush, pneumonia, and significant changes in heart rate or blood pressure. If you experience symptoms such as severe mouth pain, persistent cough with fever, or a rapid or irregular heartbeat, you should seek medical attention immediately. Monitoring for serious side effects is important to ensure the medication is not adversely affecting your health, especially if you have other underlying conditions. We made a book, 10 Questions Everyone Should Ask Their Pharmacist. You can find a link in the description below. Feel free to check it out. Number 6. Are there any drug interactions to be aware of? What medications might interact with Trelegy Ellipta? Trelegy Ellipta can interact with certain medications, potentially affecting its efficacy or increasing the risk of side effects. For example, drugs that affect the metabolism of fluticasone, umeclidinium, or vilanterol, such as certain antifungals or HIV medications, may require dose adjustments. It's crucial to inform your doctor about all other medications you're taking, including over-the-counter drugs and supplements, to avoid potential interactions. How should I manage drug interactions while using Trelegy Ellipta? To manage potential drug interactions, your healthcare provider will review your current medication list before prescribing Trelegy Ellipta. They may suggest alternative treatments or adjust dosages to minimize interaction risks. Regular follow-up appointments will help ensure that Trelegy Ellipta remains effective and safe for you while managing any interactions with other medications you may be using. Number 7. What precautions and warnings should I consider? What precautions should I take before using Trelegy Ellipta? Before starting Trelegy Ellipta, it's essential to discuss your full medical history with your doctor. Certain conditions such as heart problems, adrenaline issues, or a history of seizures may require careful consideration. Trelegy Ellipta might not be suitable for individuals with severe allergies to milk protein, as it contains lactose. Your doctor will assess these factors to determine if Trelegy Ellipta is the right medication for you. What conditions require close monitoring? Certain health conditions necessitate close monitoring while using Trelegy Ellipta. For instance, if you have a history of heart disease or high blood pressure, your doctor will regularly check your heart rate and blood pressure. Similarly, if you have diabetes or thyroid disorders, your blood sugar levels and thyroid function will need to be monitored. Adhering to these precautions help ensure safe and effective use of the medication. Number 8. What are the alternatives of Trelegy Ellipta? What other medications can be used for COPD and asthma? Several alternatives to Trelegy Ellipta are available for managing COPD and asthma. For COPD, other combination inhalers include formoterol or glycopyrrolate, and olodaterol or tiotropium. For asthma, alternatives include Symbicort and Advair Diskus. Each of these medications has different formulations and mechanisms of action, providing various options based on individual patient needs. How is Trelegy Ellipta compared with other options? Trelegy Ellipta's advantage lies in its combination of 3 active ingredients in a single inhaler, simplifying treatment regimens. However, other options might be more suitable depending on specific patient needs, such as those who may only need an inhaled corticosteroid or a long-acting beta-2 agonist. Discussing alternatives with your doctor will help you choose the most appropriate medication based on your condition and treatment goals. Number 9. How does Trelegy Ellipta affect my daily life? How might Trelegy Ellipta impact my lifestyle? Using Trelegy Ellipta can significantly impact your daily life by improving your ability to breathe and manage respiratory symptoms. With consistent use, many patients experience fewer flare-ups and better overall lung function, which can enhance daily activities and quality of life. However, it's essential to integrate the medication into your routine and follow the prescribed dosage to achieve these benefits effectively. What are some tips for managing the use of this medication? To manage Trelegy Ellipta effectively, set reminders to use the inhaler at the same time each day and follow proper inhalation techniques. Keeping track of any side effects or changes in your condition can help your doctor make necessary adjustments to your treatment plan. Regular checkups with your healthcare provider will ensure that the medication continues to meet your needs and helps you stay on top of your respiratory health. Number 10. What is the current research and future outlook for Trelegy Ellipta? What ongoing research is there on Trelegy Ellipta? Current research on Trelegy Ellipta focuses on exploring its long-term effects, comparing it with other treatments, and evaluating its impact on quality of life. Clinical trials are ongoing to determine its effectiveness in various patient populations and to assess any new potential benefits or risks. This research helps ensure that Trelegy Ellipta remains a viable option for managing respiratory conditions. Are there any potential future developments or improvements? Future developments may include improvements in formulation, new delivery methods, or combinations with other therapeutic agents. Researchers are continually looking for ways to enhance the efficacy and safety of Trelegy Ellipta, potentially leading to better treatment options for patients. Staying informed about these advancements can help you make educated decisions about your respiratory health management. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life!